We have Congress, Michigan Republican Representative Peter Hoekstra. He's here. Mr. Hoekstra, thank you. I read your Wall Street Journal article with great interest on September 4th. You have a solution, sir. Despite the fact that the president says Republicans have no solutions and is describing you personally as the problem, that's not fair. But you do have a solution. First of all, cost and control. How do you deal with that issue?
Well, actually, the way that you deal with cost and control is you put the consumer in charge of the purchasing decision. Right now, it's the insurance companies, it's the employers, it's not the employee, it's not the person that's being insured who's responsible for these types of decisions. Allow consumers to make choices. Consumers will drive quality. They will also drive cost.
And how do you do that?
Well, what you do is you got to break the tie between insurance and the employers. Right now, if you take a look at the tax code provides a very specific benefit to employers who provide insurance to their employees.
Right.
For individuals who want to go out and buy insurance themselves, they're paying that with after-tax dollars. It's inherently unfair. It is difficult for those individuals to do it. And then we also limit competition. We make it very difficult for consumers to find products on the marketplace.
All right, so let me get this right. It sounds like you want to deregulate interstate insurance, and it sounds like you want to give the tax break to the patient or the consumer rather than just the business. Is that fair?
What we want to do is we want to level out the system between the employer and we want to deregulate the marketplace. Absolutely.
All right. Mr. Hoekstra, can you stay with us for a second? We got to take a quick commercial break. Mr. Hoekstra, pardon me, I did not mean to interrupt, but we are a profit-maximizing capitalist television program, and we had to pause to let our sponsors come on. But I wanted to ask you, you outlined two ideas, interstate insurance and giving the consumer the tax break. You have a third thought on risk pooling for so-called preconditions and ill health. Could you walk us through that one, sir?
Sure. This is another problem that's been identified, pre-existing conditions. Create a risk pool. Congress has already passed the opportunity for states to create risk pools to spread the cost for these individuals that may have high cost benefits or high cost services required in the future. Encourage the states to develop these risk pools to spread the risk on these individuals that are going to need an extreme amount of care. The mechanism is in place. If it needs to be tweaked, let's fix it. But we can deal with that problem without throwing out the baby with the bathwater, which the president is suggesting.
Larry Bossidy, can we deal with that as Congressman Hoekstra suggests?
I think Congressman Hoekstra has been a nice spokesman on this subject for a while. There's two things that he said I would take exception to. One, I don't think you can pass the tax break to the consumer because employers are not compelled to offer insurance. And if they don't offer insurance, it puts an enormous hole in the provider community across the country.
Right there. Congressman Hoekstra, can you respond to the distinguished Larry Bossidy's concern?
Oh, I think, tying insurance to employment, it was never intended to be that way. That was a system that was developed 60 years ago to get by another major market fiasco.
Yes,
World War II, where the government mandated wage and price controls.
Right.
Let's get back to, I go out, I buy my own health insurance. I buy my own car insurance. Why won't people give me the same opportunity to go buy my own health insurance that fits my family, that fits my lifestyle, in which when I change jobs, I don't have to go. I don't have to wait for an employer to give me another one.
I'll tell you, one of the reasons you don't want to do it is you don't have the law of numbers. In other words, you don't have the purchasing capability to get the cost levels that employees now enjoy as a consequence of being covered by corporate citizens.
Right. That's what the employers do have.
Let companies compete for my business just like they do in health, just like they do in life insurance and car insurance, and let different bodies, let different organizations come together and form association health plans, create new pooling opportunities, open up the market, remove the restrictions on market competition, and we will be able to address those issues. Sure, if we say everything else is going to stay the same and we're only going to move the tax break to the consumer and we're not going to change anything else, of course it won't work. But if we open up the market for competition and new forms of entities to come into this business, I'll tell you, we'll attract thousands of companies who want my business and will compete for it each and every day.
Larry? Hang on one second. Yeah. Peter Hoekstra, I see plenty of car insurance ads. They're good ads. They're very clever ads. I never see any health insurance ads. Why is that?
Well, because we've restricted the access of insurance companies to sell us individual markets, plus we've restricted the financial ability of me to go out and buy it, recognizing that when I get it from my employer, he's paying with it with before taxes. I'm paying with it with after-tax dollars. We've built up this system that no longer is an effective way. We've got a lot more entrepreneurs in the marketplace today. Careers are no longer tied to a single company for 20 or 30 years. We open up this marketplace, we will have competition, we will improve quality, and we will lower cost. And most importantly, we will put consumers in charge of this process, not insurance companies. And heaven forbid we put the government and government bureaucrats in charge of this process and believe that we're going to drive down costs and improve quality.
You
That's
saw
not
that
going to
very
happen.
You heard the distinguished Mr. Hoekstra.
Yes.
If he can do for health care what he did carefully monitoring our intelligence agencies, which was pretty damn good, helping to keep America safe the last 8 years, what do you think? Did he make the sale with you, Mr. Bossie?
He didn't. I think he makes a good point. It's a little idealistic. I think to get from where we are to where he wants to go is a long putt. And we're going to have some intermediate steps before we get from here to there.
Larry, what no one's talking about in all this, which I think is very ungenuine on the part of the leaders of the House and the Senate, is we are naturally going to spend an awful lot more money the next 10 to 20 years just because we're living a lot longer. We have to examine.
Isn't that good? Seriously,
that's a fantastic thing. That's a great thing. That's a great thing.
There's a study out by a former Nobel Prize-winning economist from the University of Chicago, and he is saying we must spend much more in the private sector on health care, precisely for the reasons you gave. In other words, the baby boomers are maturing, the incomes are rising, and the technology, especially the biotechnology, is absolutely fantastic.
Six years ago.
Therefore, if we have to put constraints on, let's try to constrain government spending and fix the bankruptcy in Medicare and Medicaid, but let's let private spending. This is a health growth industry. This is our greatest growth industry, Bill Smith. 400,000 new jobs in the last year during a terrible recession. What does that tell you?
6 years ago, chronic illness passed acute illness as the leading killer. That means that baby boomers are going to live a long time with a lot of aches and pains, and rather than what they've told you, pharmaceutical products are the least expensive way to deal with chronic illness and only make up 10% of the total cost of health care.
Go ahead, Andy.
One thing about this Baucus bill that's good, and I know we've been bashing it quite a bit, but there is this section in there for catastrophic illness. At least Baucus recognizes that people from 25 and under don't need, most health care insurance. They just need the catastrophic. And most people around this country, that's what they would accept. So I think that's a bargaining point, and that's something that you can compromise on between the Republicans and the Democrats.
You do agree with that?
I do agree with that. It's a good point.
All right.
Good point.
Mr. Hoekstra, I want to ask you about this concept. We need more health. We need more health care, not less. This is America's greatest growth industry. The jobs are growing between the doctors, the hospitals, the pharmas, the biotech companies. We should have a third of the economy. I mean, it would be like stopping automaking at the turn of the last century, Mr. Hoekstra. Isn't that? Can't we figure out a way to liberate the great American private sector health industry?
I sure hope so. And what we'll do is we'll attract investment, and we'll attract the customers from around the world to come to the U.S. for the best quality health care in the world. It's a place where we have a competitive advantage and we can expand it.
Right.
You agree with that, Larry Bossie? We have room to grow. The idea that we spend too much on health care, I beg to differ. I think this country can produce unbelievable more health care, grow, prosperity, economic recovery. I'm quite serious.
I think the issue is this. With more productivity, you can have lower cost and better health care. We have an enormous amount of waste in the healthcare system in this country, and there's nobody addressing it. That's going to have to happen first.
And the government's just going to have to insure the chronically uninsured. Isn't that the bottom line? Either through vouchers or tax credits or some darn thing?
It isn't going to be up to the states. The states that have it hate it. I mean, it's cost them enormously more than they ever expected.
Will the Republicans concede that the 10 or 15 million chronically underinsured or non-insured will have to have government assistance? Is that a GOP concession?
I believe that is a concession that the GOP is willing to make. That recognizes that is a huge cost and something that probably needs some level of government support.
So if you put your crystal, take out your crystal ball, Mr. Hoekstra. Is there conceivably a deal, or is just going to be, partisan Democratic plan going down? How do you see it, sir? Last few moments.
I think this is going to be a partisan deal. As someone mentioned earlier, I'm idealistic. I want to move towards the consumer. Democrats want to move towards government control. I don't know how you reconcile those differences.
All right. We're going to have to leave it there. I'm sorry, gentlemen. We're flat out of time. Congressman Peter Hoekstra, we appreciate it very much. Larry.